Autism and autism-related disorders are an epidemic in this country right now. You're talking about 1 in 150 children with autism. That defines an epidemic by proportions, especially when you consider 2.5% of the population defines an epidemic. Well, here we are, a modern-day epidemic. The biggest problem that I see with this condition is the treatment, both on the allopathic side and on the alternative side. The treatment frustrates me. The diagnosis frustrates me. But hopefully this video could shed some light. On the allopathic side, we're looking at treatments that really don't exist. Talking about medicating children and just covering up the symptoms. On the alternative side, we're looking at a focus that really is a better focus, but still a lot of symptom covering. A lot of treatments that are dealing with digestion, which I do in my clinic. I think it's a part of this treatment. A lot of treatments that have to do with allergy relief, as far as food intolerance, I do that as well. However, both sides aren't getting to the true cause, and that is the fact that this is a neurotoxic condition. Even on the alternative side, the detox that I see is done completely wrong. The alternative side, they won't even mention the word. However, if we are going to make a difference in this epidemic, we have to get to the cause. It is a neurotoxic condition. One of the things that I developed is this puzzle, and I can tell you right now it's divine intervention. I am definitely not smart enough to come up with this, but what the puzzle does show us is that there is a diet that works for this condition. It's not just the gluten casein diet that you see in the autism world. It goes beyond that. This is a diet that really removes inflammation, and that is one of the big problems that needs addressed with this condition. It's a diet that heals the cell, and it's a diet that also helps with hormone regulation because there is so much hormone dysregulation. When we look back at the puzzle, toxins play a big role, but a lot of toxins people aren't addressing, like biotoxins. It plays a role. Matter of fact, it is really the bioaccumulation of all these toxins that plays a significant role in the treatment of this condition. So, of course, if you're not addressing the toxins, you're absolutely not going to get the child well. But when we look at this, deficiencies, I think the alternative world really looks and does a good job of picking up some of these deficiencies, whether it be zinc, whether it be iron, and there's several others, magnesium, and of course even vitamin D. However, the big one I think they mostly miss, and that's the fact that they are antioxidant deficient. I think we hear some talk now about glutathione, but it only plays one piece of the puzzle. Please watch my other videos that I've done on neurodegenerative conditions, multiple chemical sensitivity, MCS, chronic fatigue, because I speak of something called the no-ono cycle and how important it is in really fixing these types of conditions, brain inflammation, etc. If you don't downregulate this vicious cycle of inflammation and oxidative stress, you will not get the patient well. If you don't detox the patient, you will not get the patient well. I speak of these two treatments coming together is really giving us an answer to some of these new millennium conditions. And you see it right here in the puzzle. However, we also look at nerve stress. On some of the past videos, and again, check out my website there, I talk about something called NMDA. It's really a neurotransmitter, the most stimulated neurotransmitter in the brain, and it plays a significant role when these children get misalignments in the upper cervical spine because it keeps this oxidative stress inflammation cycle firing. So if you don't deal with that type of nerve stress, you will never downregulate the inflammation. If you don't downregulate the inflammation and oxidative stress, you're not going to get the child well. Look, it goes beyond the gut. It goes beyond the GI. We have to get rid of this inflammation in the brain. It goes beyond detox. It's the combination of treatments that works. I can tell you from personal experience, as we had a child who was on the autism spectrum, and I felt like I had a glimpse out of it in my own eyes. And I'll tell you right now, if I didn't go through what I went through, I would never have been able to get my own child well. And if he was my only patient, me going through what I went through was worth it. However, God has been good, and He has worked it for good because I've been able to help so many people and thousands with these conditions. Thank you, and I hope that helps.